Hello, my name is Elizabeth Caselny, and I am a BSN student at Indiana State University, currently in community health nursing. Today we're going to be talking about mental and physical health concerns for foster children. First, let's look at our learning objectives. The first is to identify foster care needs in the U.S. Next, we will define toxic stress and its effect on foster children. Then we'll identify the impact on health that foster children face, as well as identifying difficulties with accessing health care for foster families. Then we'll describe some strategies and interventions to improve health care for foster children, and finally, successfully navigate using useful resources that help with the foster system. First, I'd like everyone to take a minute and pause and go down to the link at the bottom and take the pre-test. This is going to test your knowledge of what we're talking about today, and then once we're done with this PowerPoint slide, you will take the post-test to see how much you've learned. All right, so now that we're back, we're going to talk about foster care in the U.S. At any given moment in the U.S., there are about 400,000 kids in foster care, according to Hodges et al. There's multiple different reasons for their removal, unfortunately, but the main three are child abuse, neglect from parents, and the loss of a parent, according to Forkey. After a child is placed within a new setting, the American Academy of Pediatrics recommends an initial health screening by a pediatrician within at least 3 days of placement. So what is toxic stress and trauma? Unfortunately, foster children may experience severe levels of trauma from an early age because of home removal due to child abuse, neglect, and loss of a parent. This trauma can have far-reaching effects on their mental, physical, and overall health well into their adult years. What is toxic stress? Toxic stress results from the frequent and prolonged experience of a traumatic environment that causes an extreme stress response, especially when there's no buffers that are present, such as a supportive parent or adult. When toxic stress is experienced in childhood, it has been linked with both poor physical and mental health outcomes, as well as increasing the risk for COPD, diabetes, depression, suicide, and learning abilities. So what is the interaction between foster care and health concerns? Unfortunately, about 80% of foster children have at least one medical problem, with at least 80% of foster children having one serious mental health need. Additionally, 60% of children under the age of 5 have developmental concerns. The average monthly cost for a foster child on state Medicaid is $376 versus just a $70 cost for non-foster children on Medicaid. This shows that unfortunately, foster children need to use a higher level of health care with increased cost. There is also a higher rate of mental health issues like depression, anxiety, ADHD, PTSD, conduct disorder, and behavior concerns due to the trauma that they experience. Behavior issues are typically the main leading cause for placement in another home. This starts a circle of behavior. Once they're placed in another home, it creates more trauma, and then that in turn creates even more behavior concerns. What are some problems with healthcare access? Before the child is even placed or removed from the home environment can be very disruptive. There's also the problem of missing medical records and information, as well as there's problems like accessing primary care and preventative care even after the child is placed within a foster family. There has also been shown that there is a fewer number of pediatrician wellness visits when compared to non-fostered children, and that number decreases even more so if the child has a behavioral or mental health condition. It's important for pediatricians to treat each visit as a comprehensive well check in order to make sure that they are receiving the care they need. Foster children are also dependent on state and Medicaid insurance. And unfortunately, there is a decreased number of physicians that accept Medicaid insurance compared to private insurance companies. There's also an insufficient amount of resources in order to meet the mental health needs for foster children. So what are some strategies that we can use in order to improve healthcare in foster children? The first is the health passport. This is a collection of the child's medical records, including vaccines and immunizations, as well as prior illnesses and surgeries, their social information, as well as their educational records. This collection will travel with the child no matter where they go, so that there always is information available for them. Healthcare coordination has also been shown to improve the quality of healthcare and communication. Healthcare coordinators provide resources and health services to foster children and their parents. This increased quality of healthcare and communication between families and providers leads to a more successful foster, child, and parent outcomes. Some interventional programs that are aimed at foster children and foster parents have also been shown to be successful. The ABC program typically focuses on toddlers and works to improve their relationship with their foster parents early. The Incredible Years program helps to teach strategies to foster parents of young children in terms of coping and dealing with trauma. And the Take Charge program helps adolescents to learn new skills and useful information, which then increases the likelihood that they will complete high school and go on to get a gainful employment or even secondary education. So what are some additional resources that we can look into? The first is childwelfare.gov, which is a government website that gives useful information for foster families. The second is a website called parentcenterhub.org. This is for parents of foster children and provides useful resources and information to support them. The next one is called adoptuskids.org. This again provides some useful information as well as some information for older foster kids in order to help them understand and cope. The last place that we can look at is called the Annie E. Casey Foundation. And this is another website that provides useful information to both adults and children. Here are my resources. And now I'd like you all to go ahead and take a second and go down to the bottom and take the post test to see how much you've learned from this presentation. If you have any questions, please let me know in the comments or send me an email. And thank you for listening today.